The treatment of prostate cancer is associated with certain complications. The two most common are urinary incontinence, which is the involuntary loss of urine or the inability to hold your urine, and the second is erectile dysfunction, which is the inability to obtain or to maintain an adequate erection. Urinary incontinence that occurs after treatment for prostate cancer with either surgery or radiation therapy occurs in only about 5 or 10% of patients. Generally, the incontinence is relatively mild, but a small percent of patients do need treatment, and treatment is very effective. There are two main types of incontinence after treatment for prostate cancer. Urgent incontinence is the sudden need to go associated with a small amount of leakage. This is the gotta go syndrome. Treatment is usually a combination of medication, behavior modification, and pelvic floor exercises called Kegel exercises. Surgery is seldomly needed in the treatment of urgent incontinence. Stress incontinence is when a man leaks with laugh, cough, sneeze, any heavy lifting or straining. The treatment of stress incontinence is primarily surgical, and there are two main treatment options in men. One is placement of a male sling. The other option is placement of an artificial urinary sphincter. Both options are very successful. Other options for stress incontinence include behavior modification, medication, Kegel exercises, and injections, but they don't work as well as the surgery. Erectile dysfunction, on the other hand, occurs more frequently than incontinence after treatment for prostate cancer. However, erectile dysfunction is universally treatable. Treatment options for men with ED include oral medications, placement of a small urethral pellet that dissolves and helps with erections, directly injecting the penis, and another option is use of a vacuum erection device. Surgery is generally reserved for patients who fail all of the other options. The surgery is straightforward and consists of placing a penile prosthesis. Penile prostheses provide a very high level of patient and partner satisfaction. The bottom line is, no man should be afraid of screening or treating prostate cancer because he thinks he may be impotent or incontinent. If either or both complications occur, highly successful treatment options are available, and men can lead normal lives after prostate cancer. If you have trouble with incontinence or erectile dysfunction, talk to your primary care physician or see an MIU urologist.